Hello, welcome to Chapter 16, the last chapter of medical terminology, infancy to old age. So today we're going to take a look at different words that relate to pediatrics and geriatrics. Pediatrics, children, geriatrics, the elderly. So we're going to talk about everything that pertains, or most things that pertain to these two ends of the spectrum. So let's start with the neonatal period. This neonatal period is during this fetal development. Fetal or fetus is a term that is used starting at 8 weeks. Before 8 weeks, it's known as an embryo for those first 8 weeks, but from 8 weeks on, it is known as a fetus. That neonatal period technically is from birth to 4 weeks of age. So at birth, the neonate must make many adaptations to life outside of the uterus. Pediatrics is the treatment of children from birth to 18. So here's the APGAR scale, which is an evaluation of a newborn's status. That APGAR scale is given at 1 minute and 5 minutes after birth. This neonate is given a score from 0 to 2 in each category on muscle tone, pulse, responsiveness, skin color, and respiration. A score of 7 or above is normal. A score below 7 indicates the need for special immediate care, including oxygen and airway suction. The APGAR score, named after Virginia APGAR, who created it, does not predict long-term health or intellectual status. It only gives immediate, lets the doctors and nurses know immediate care that may be needed. So neonatology, natology, is the specialty of treating newborns. So we have the root combining form neo, which means new, the root nat, which means born, and then that ology, which is going to mean the study of. Pediatrics is that medical specialty of treating children during development from birth through adolescence. That root ped means child. We also have iater, pediatrics, means medical treatment, and then that suffix of ix means knowledge. Oops, I can't spell. Still not right. SIDS. Sudden infant death syndrome. This abbreviation, SIDS, sudden infant death syndrome, is something that we don't necessarily know the cause of it, but it's where infants suddenly die. So the cardiovascular system, during these neonatal adaptations of the fetus, is dependent on the placenta, this cardiovascular system. So at birth, the two major cardiovascular system divisions, the pulmonary and the systemic circulations, become separate and operational. So the infant can provide their own oxygen and nutrients and remove carbon dioxide and fetal wastes. So congenital cardiovascular defects occur in about 1% of births. So we have patent ductus arteriosus. This is when the opening that shunts blood from the aorta to the pulmonary artery in the fetus does not close. And then we also have atrial septic or septal defect is when the opening between the right and the left atria in that heart does not close. And then there's ventricular septal defect. This is when the opening between the right and the left ventricles does not close. Cyanosis is when insufficient blood is being pumped to the lungs, and this causes insufficient oxygen levels in the neonate's tissues, which gives the baby's skin a bluish appearance. And then we have that tetralogy of Fallot. Tetra means four. So this is heart defects that shunt blood away from the lungs. Children with tetralogy of Fallot do not grow, are dyspneic, so they have difficulty breathing, and require open heart surgery to correct these defects. So let's look at some of these different abbreviations here. ASD is that atrial septal defect. CVS is cardiovascular system. PDA is patent ductus arteriosus. This is tetralogy of Fallot, and then we have ventricular septal defect. Okay, let's look at these words. Cyanosis means a blue discoloration of the skin, lips, nail beds caused by hypoxia. Cyanotic, that adjective form, means pertaining to the blue discoloration of cyanosis. Dyspneic or dyspnea means difficulty breathing. Dyspneic means pertaining to or suffering from difficulty of or in breathing. Respiratory distress syndrome occurs when a premature baby is born without adequate surfactant in the lungs. Hyaline membrane disease is another term for respiratory distress syndrome. Meconium aspiration syndrome. Meconium aspiration syndrome, there we go, occurs when the fetus is stressed in the uterus or during delivery and inhales that mecum into the lungs. Mecum is usually that first intestinal discharge of the newborn. It consists of epithelial cells, mucus, and bile. Treatment is by intubation and suction of this meconium stained fluid. Transient tachypnea of the newborn occurs when amniotic fluid remains in the lungs of that neonate. Tachypnea, that fast breathing. Sudden infant death syndrome, that's SIDS. It's when an infant who dies while sleeping with no cause of death determined upon autopsy. Sudden infant death syndrome may occur when an infant fails to develop respiratory control mechanisms, or it may be prevented by placing infants on their back to sleep and removing soft pillows, mattresses, and bedding from the crib. But let's do some more abbreviations here. We have hyaline membrane disease, RDS, respiratory distress syndrome, SIDS, that's sudden infant death syndrome, and then TTN is that transient tachypnea of the newborn. Infants lose heat more quickly than adults. This is why the newborn is dried, wrapped, and placed in a warmer birth or warmer after birth. Hypothermia is more likely to occur in a premature or small or date neonate. A newborn baby's brain is 1/4 the size of an adult. So at birth, only the spinal cord and brain stem are well developed. All of the newborns kicking, grasping, rooting, searching for that nipple, and crying behaviors are functions of the brain stem, which is why they are not well coordinated. Anencephaly is the absence of the cerebral hemisphere. That an means without. Microcephaly is an abnormally small cerebral hemisphere. Encephalocal encephalocal, sorry, is the protrusion of the nervous tissue through a defect in the skull. And then hydrocephalus is accumulation of excessive cerebral spinal fluid in the ventricles of the brain. So spina bifida occulta, or spina bifida in general, is when the vertebral column fails to close around that spinal cord. So spina bifida occulta occurs when the vertebral arches fail to unite and there is no neurologic involvement. Spina bifida cystica is when nervous tissue protrudes outward and may contain meninges and part of the spinal cord or both. Neonate seizures are caused by abnormal brain activity. Primary seizures occur from an intracranial disorder such as meningitis or cerebral hemorrhage. A secondary seizure occurs from a systemic disorder such as hypoxia, hypoglycemia, hypocalcemia, and treatment is going to depend on that cause. So some different craniofacial disorders. We have a cleft lip and a cleft palate. This involves incomplete closure of the lip, that maxillary bone and palatine bone. Difficulty with feeding and speech development may occur. Treatment is usually surgical repair of the bones and the soft tissue in that area. Developmental dysplasia of the hip, or a congenital dislocation of that hip is what it is more common following a breached baby. A breached baby means the butt's coming out first. Diagnosis can be confirmed with ultrasound, and it is treated with padded diapers and or surgery. So let's look at these different words. Remember I just said an means without. So anencephaly. Encephaly is a condition of the brain. So anencephaly is a born without cerebral hemispheres. They will not survive. They need their brain to function. microencephaly. Micro means small, then that encephaly or microcephaly means the brain or the head. So microcephaly is that small head. Encephalocele and myelocele both share that suffix cele, meaning hernia or swelling. Encephalocele contains the root form and combining form encephalo for brain. So encephalocele is a congenital defect of the cranium with herniation of brain tissue, while myelocele contains that root combining form of myelo or spinal cord. So myelocele is the protrusion of the spinal cord through a defect in the vertebral arch. So inadequate nutrition caused by poor placental function can cause a neonate to fail to grow fully in utero. If the newborn is below the 10th percentile of babies in that same gestational age, it is considered small for gestational age. Premature labor and delivery prior to 37 weeks gestation can cause a low birth weight baby. Immature development of the central nervous system leads to poor sucking and swallowing. So premature infants may have to be fed by IV or gavage, which is a stomach tube. Failure to thrive is a term used for an infant or young child not developing normally. It may be caused by chronic illness such as fetal alcohol syndrome, hormone disorders, or psychosocial disorders such as poverty, parental lack of education, neglect, abuse, or parental mental illness or substance abuse. So FAS, fetal alcohol syndrome. FTT, failure to thrive. SGA, small for gestational age. So let's look at urinary system adaptions or congenital urinary tract disorders. Renal angiogenesis. A means without, genesis means that creation. So when one or both kidneys is absent. I have renal angiogenesis. I was only born with one kidney. It happens. Hydronephrosis of the kidneys is caused by a blockage in urinary flow in utero. Polycystic kidney disease is a genetic disorder in which cysts form in the kidneys, destroying functional tissue. Then hydrosphatus of the penis is when the urethra opens, not at the tip, but on the inferior surface of the penis. So to feed by a stomach tube, gavage, post-mature is an infant born after 42 weeks gestation. Premature is an infant born prior to 37 weeks gestation. Then agenesis is the failure to develop any organ or any part. Esophageal astria is an incomplete formation of the esophagus. Colic, long periods of unexpected crying in an infant that usually resolves around 3 months. What causes colic? Is possibly an immature digestive system. And then food intolerance. is an inability of the small intestine to digest food, causing irritability, crankiness, bloating, flatulence, nausea, vomiting, and diarrhea. Lactase deficiency, that lactose problem, can't think of the word I was just trying to think of. It can cause an intolerance of foods containing lactose, that milk. Breast milk provides antibodies, digestive enzymes, and hormones that infants need. Breast milk is non-allergenic. It's that formula. Sometimes there's formulas that contain milk in it that can cause these food intolerances to happen. The newborn's immature liver may not be able to break down bilirubin from excess red blood cells. This is what causes jaundice. Jaundice is treated with phototherapy, so putting those newborns under a light. Immunizations are given to confer immunity against a variety of viral illnesses. Some of these illnesses, like measles, mumps, rubella, varicella, pertussis, which is whooping cough, and diphtheria. Food allergies may develop when the immune system recognizes food antigens as pathogenic antigens. The most common allergies: milk, eggs, wheat, soy, and peanuts. Here's some kind of cool things, little facts. A fetus can hear noises at 24 weeks of gestation. So, fetal experience with sounds makes the neonate more responsive to speech after birth. Congenital malformations of the external auditory canal, middle ear, and inner ear can result in hearing loss. A newborn can see and focus on an object between 8 and 12 inches away. Full color division usually develops by 3 to 4 months of age. So congenital means present at birth, either because of inheritance or an event during gestation up to the moment of birth. Malformation is that failure of proper or normal development. Temperament means that predisposition to character or personality. Enuresis is bedwetting. In a child who has been trained to use the toilet and is dry by day, the child does not wake up after wetting the bed. And is fecal soiling beyond the age at which toilet training should have occurred, usually between 3 and 4. Treatment is to prevent constipation and use conditioning therapy. Pica is eating non-nutritive substances, like non-food substances. Hair, people will do that. Fingernails, the list could go on, it's gross. Rumination disorder is a persistent regurgitation and rechewing of food after eating. Then food disorder of infancy is refusal to eat adequately and failure to gain weight. Anorexia nervosa occurs in adolescent females, not just females, it does occur in males too, who have an inaccurate perception of their body size, weight, and shape and refuse to maintain a normal weight. Bulimia. I like how your textbook always says it's females because it's more common in females, but it does happen in both sexes, males and females. Occur in adolescents who binge eat 2 or 3 times per week and then make themselves throw up. Then that binge eating disorder is usually binge eating 2 to 3 times weekly without compensatory vomiting. Attention hyperactivity or attention deficit hyperactivity disorder, ADHD, is usually characterized by three components. Inattention, that inability to pay attention, carelessness, distractibility, and disorganization. Hyperactivity, excessive activity such as fidgeting, squirming, inability to sit still, and excessive talking. Impulsiveness is shown by interrupting others, intruding, and inappropriate actions. The attention deficit hyperactivity disorder is often treated with, these are such old drugs now, Ritalin and or Prozac. Those are old. There's a lot of newer drugs out there that work much better than Ritalin or Prozac. Putting that out there. But these are what your book are saying, so we have to go with what your book says for now. But there's a lot of other stuff out there that work much better. Then treatment may include special education, parent training, and cognitive behavior therapy. Learning disabilities. Learning disabilities are grouped together to include disorders in reading, spelling, or writing, or difficulty in understanding words or sounds. Like dyslexia is a term for a learning disability characterized primarily by difficulty in reading and spelling words. Some days I tell myself I'm dyslexic. You've probably seen it if you've watched all these videos, me trying to spell words and having to fix them. Oppositional defiant disorder is characterized by defiance, disobedience, and hostility towards parents and teachers. Conduct disorder occurs in older children and adolescents and is characterized by running away, fighting, substance abuse, cruelty, and bullying. Treatment for these disorders includes behavior therapy, psychotherapy, and parent training. Obsessive compulsive disorder. These people have obsessions that are recurrent, unwanted thoughts, and compulsions are irresistible, repetitive behaviors. A lot of people like to say that they're OCD about things, but somebody who truly has obsessive compulsive disorder, they will literally lock and unlock their door 4 or 5 times to make sure that their door is locked before they leave their house. They will open and close that refrigerator 4 or 5 times in a row successively, like not open and look around, open and close it to make before they actually open it or close it. They will repetitively wash their hands 4 or 5 times to make sure that their hands are really washed. Autism spectrum disorders is characterized by poor social interaction and communication skills and repetitive behaviors. It is a very large spectrum. Asperger's syndrome is the most mild form to a very severe form of autism. PDD-NOS is pervasive developmental disorder not otherwise specified. Is the diagnosis for children who show some characteristics of autism spectrum disorder, but do not meet the specific criteria. So let's go through some of these abbreviations. CD, conduct disorder. LD, learning disorder. ODD, positional defiant disorder. Attention deficit hyperactivity disorder. Autism spectrum disorder. OCD, obsessive compulsive disorder. And then pervasive developmental disorder not otherwise specified. Okay, let's look at the adjective form of these words here. New color. Autism. Autistic. Dyslexia. Going to become dyslexic. Obsession becomes obsess. I think I spelled that wrong on the other page too. Obsessive. E-S-S-I-V-E. So let's fix my spelling up here then. Obsessive. There we go. Obsessive. Obsession becomes obsessive. There we go. Okay. Compulsive is used to describe someone possessing uncontrollable impulses to perform an act repetitively, like habits or rituals. Obsessive is used to describe someone possessing persistent, recurrent, uncontrollable thoughts or impulses, like those obsessive thoughts of, are my hands clean? Is my door shut? Is my door locked? Impulsive is used to describe someone with an inability to resist performing inappropriate actions, like that urge to interrupt someone who's talking, who can't wait. So let's go look at aging, sentience, and death. The other end of the spectrum. So lifespan. Lifespan is the age to which a person lives and the process of getting there. Life expectancy is the average length of life for any given population. Longevity is living beyond life expectancy. Aging refers to the process of human maturation and decline. Sentience is that state of being old. Geriatrics is the medical specialty of the care and treatment of the elderly. So what happens to all of our different systems as we get older? That integumentary system, your skin becomes thinner, less elastic, and wrinkly. It loses melanocytes as we age, so those cells that make your skin color. Senile, or we get age spots start to appear and hair loss occurs. Sight and hearing decline with age. Taste and smell are also minimized. Osteoporosis, as well as joint and bone pain, occur with age. Muscle mass and strength are also lost. Sarcopenia. In the nervous system, motor coordination, intellectual function, and short-term memory decline in old age. In that cardiovascular system, atherosclerosis causes a decline in cardiac output, and narrowed vessels increase the risk for thrombosis, leading to strokes and heart attacks. That respiratory function starts to decline in old age as the lungs become less elastic and the rib cage becomes flexible. That urinary system, the kidneys become less efficient as the number of nephrons decline. And that immune system function also declines with age, which means that the elderly have less protection against infections and diseases and cancer. So hospice provides palliative care and provides for the emotional and spiritual needs of terminally ill patients and their loved ones at an inpatient facility or in that patient's home. Palliative care is designed to provide pain and symptom management to maintain the highest quality of life for as long as life remains. Brain death refers to no cerebral or brainstem activity and a flatlined EEG for a specific length of time. A persistent vegetative state refers to the state in which the patient has suffered from brain damage, but his lungs respire and his heart pumps blood because of brainstem activity. The patient's eyes may also open, although they are unaware of their surroundings. Minimally conscious state is a condition of severely altered consciousness in which minimal, inconsistent evidence of awareness or self or surroundings is demonstrated. Coma means to sleep in Greek. It is the state of deep unconsciousness. Hospice means lodging in Latin. It is a system set up to provide care to the terminally ill and their families. Autopsy means to see with one's own eyes in Greek. It is that examination of the body and organs of a dead person to determine their cause of death. Consciousness is that state of being aware of and responsive to the environment. Death is the total and permanent cessation of all vital functions. Vegetative refers to functioning unconsciously as plant life is assumed to do. Sarcopenia is that progressive loss of muscle mass and strength with aging. Palliative care means to relieve symptoms and pain without curing. BD, brain death. MCS, minimally conscious state. PVS is persistent vegetative state. That should be a V. And this is everything from growth and development through geriatrics. As we get older, everything just starts to decline. That's just part of life. There are ways to prevent it, like exercise and good nutrition can help prevent some of that degeneration. Exercise is a big one. It can keep your bones strong. It'll keep your muscles strong. It's worth it. That is everything about chapter 16. Thank you very much for listening and have a wonderful day. Bye.